now we're going to do the neurovascular testing. So there's two pulses in the foot. There's the dorsal pedis pulse, which is right in here, and you're going to just feel for it. You're going to want to try to feel for it, and like you're looking to see like if it's present or if it's like a decreased like pulse. And you want to compare these two bilaterally to make sure that you're getting an accurate read for them, because their pulse may be different than another person's pulse. And then there's the posterior tibial pulse. So you're going to want to look for that one too. And you're going to do the same thing. You're going to feel for it and try to find the pulse. Once you find it, you're going to just see how, like, whether it's weak or strong, and then you're going to want to compare that to it bilaterally too. And then you're going to do dermatome and myotone testing. So for the dermatome, for L4, you're going to go from the lateral thigh down, like, across the patella to the great toe. And then for the myotone for this is going to be ankle dorsiflexion. So you're going to want to dorsiflex the foot. Okay. And then for the L5, it's going to be from the lateral thigh, and it's going to go to the anterior lower leg and then down to like right in between the first and second toes. And then with this one, it's going to be great toe extension, so the push the toe down. And then with the S1 is going to go from the lateral thigh, or the lateral hamstring to the gastroc, and you're going to follow that path, and it's going to go down to the base, like, of the fifth, like, metatarsal region, like the fifth toe. And with this one, it's going to be plantar flexion, so it's like the ankle is going to be pushed down, like pushing on the gas pedal. And then the S2 is going to be from the medial side, and it's going to go down to by the Achilles tendon and the calcaneus. And then with this one, it's going to be knee flexion. And then now there's the quadricep reflex. So we're going to have to... Okay. So then you're going to find the area for the quad, and then watch it move. And you want to compare this bilaterally too, because you want to see what's normal for that person. If it's if they're both like, if it's like a problem bilaterally, that means it's more of like an upper neural problem. And then if it's like unilaterally, if it's just one side, it's going to be the lower, like a lower neurological problem. And then the same thing with the Achilles is you're going to tap with the reflex hammer in the back. This one is harder than the first one, and you can't really notice much of a movement with this. Yeah. Okay. And you're going to want to check that bilaterally too, to see if it's a slight movement, and then you want to just see what's normal for them. It's the same if there's a problem bilaterally, it's an upper like a neural problem, and if it's a problem with just one, which is unilaterally, then it's a lower neural problem.